Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Bailey Merzick, also with the Department of Communication. Today, we're going to chat with Chief Medical Officer Dr. Jeff Desmond and allow him to reflect on a lengthy career before he retires at the end of 2022.
Now, before we meet with Dr. Desmond, be sure you go back and reflect on any episodes of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. New shows debut weekly and can always be found on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review.
All right, with that, let's bring in Dr. Jeff Desmond, who has served as Chief Medical Officer at U of M Health since 2016. Dr. Desmond, thank you so much for joining us today.
Thanks for having me. Happy to be here.
All right, well, first, can you talk a bit about your career here at Michigan Medicine, sort of how it started, the different roles you've held, and how you've gotten to where you are today?
Yeah, great question. Sometimes I ask myself that on a daily basis, but I've been here for a long time. So I came here as a faculty member in 1993. And, one of the things I'll reflect on is just a huge opportunity that this has been, both, professionally in emergency medicine for me, as well as in an administrative role, which ultimately, landed the last 7 years as the chief medical officer. But when I joined the faculty, one of the early faculty members in the Division of Emergency Medicine, there was no Department of Emergency Medicine. We were a division within surgery, and Bill Barzin, who was the first division head and became the first chair, was really brought here to bring the specialty of emergency medicine to the University of Michigan health system. So we started out as a division in surgery and a small group of faculty, and then over the years gradually grew and became one of the next academic departments. So we became a full academic department here. Managed the operation of both the adult emergency department. We had a children's emergency department that was adjacent for a while that started as a children's walk-in, became a children's emergency department, and then with the children's hospital, we really expanded children's emergency services to be what it is today. And then just tremendous growth in emergency medicine and across the health system, and also growth in the other missions, our research and teaching missions. So, we're one of the highest, if not the highest funded research department in emergency medicine, academic department in emergency medicine across the country, and also have a joint residency program in emergency medicine with St. Joe's in Ann Arbor, and then a number of fellowships, including pediatric emergency medicine, EMS, ultrasound, and critical care. So it's really been an honor and a very unique career experience to be able to come to an institution that has the resources, the quality and the stature of Michigan, and be able to bring a specialty here and be part of that journey of growing, both the specialty and the research and education missions, the clinical care specialty, the research and education missions for the institution. So, kind of ended up being the right person in the right place at the right time to have that opportunity. But it's really been great, and I've been honored to be able to play even a small part in that.
Yeah, so a lot of different things happening during your time here. So while you've been here, how has medicine and the way it's been carried out changed over the years?
Yeah, so when you've been here almost 30 years, it has changed. It's changed a lot. I think there's some very obvious things that people would think of. First of all, there's just been the advancement of the science of medicine, which is, increasing at an ever increasing pace. And so the scope of knowledge, the level of understanding, and the expansion of the scientific understanding of disease and the treatments that we have for it has just phenomenally expanded in the last 30 years. We have people that get treatments at home or live with devices at home that we couldn't even deliver in the hospital 30 years ago. So that level of complexity of care that has evolved from the advancement of the science and understanding of disease and the development of treatments. Really, I think that's one of the fundamental things has been that we increasingly care for increasingly complex patients, and that there's people alive with conditions now that are chronic conditions that they never would have survived even 30 years ago. So that's remarkable, I think, in and of itself. Like other parts of I think society and the world, the boom and the expansion of information has been one of the other things that's just been almost impossible to keep up with in medicine. And the availability of information, both general information, the way to access that. I mean, you can think about it. You can even see in the shelves behind me, textbooks, which are kind of a thing of the very past right now. And the accessibility of information is just remarkably different. The electronic health record and the availability of information that supplies, that provides for us, has been a phenomenal change. And while I think some people can argue that it's been a burden and has been challenging, I think sometimes we forget how difficult it was to access information prior to that. We kind of joke around. One of the early things that we did in the emergency department that we thought was an advance was that we would, as soon as the patient registered, we would call down to medical records to get their charts delivered, their paper charts brought up on a cart by a person to the emergency department, so that if we needed them, we could look through their past history and see what it has. So, the ability to manage all that electronically is remarkably different. Also has new and different challenges to it, right? And the ability to assimilate and manage that information. I'm not sure our tools and our capacity to manage information has matured at the same rate as the growth of information. So I think that's one of the particular challenges. And then I think the growth of the health system and our increasing role that we play across the state has obviously expanded. The capacity constraints that we feel here and the operational challenges. Again, I'll reflect, when I was an early faculty member, we used to have meetings up on some of the floors because we had floors that were closed and were being used as administrative offices, back in the 90s. And that was really driven by a huge, transition of inpatient care to outpatient care, which took place across the nation in healthcare. And now our ability to grow and expand. I mean, we use every, as people know, we're challenged with capacity both on the inpatient side in our ambulatory care clinics due to increasing demand. And the demand really comes from the quality of the care that we can provide and the expertise. I think the compassion and the skills of our providers. I really think that is our greatest asset. And we really, from an administrative perspective, really need to do everything we can to allow that asset to be both used as efficiently and effectively as it can be, and also to provide that access to people across the state. So I think it's almost everything has changed, and then, nothing's changed because it's still that interaction between a provider and the patient, the development of that trust, the empathy, the care that we provide, that is the foundation of what we do. And that is the value that exists in healthcare. The rest of it has become incredibly complex around that, but that is I think the enduring value in healthcare. And that's why it's been a huge honor to be a provider and a physician in a system like Michigan that values that and really has tried to keep that at the forefront of the decisions that we make.
Yeah, I think that's essential that, it's been that way for 30 years. It'll be that way for the next 30 years, right? It's no matter how much technology changes, it's that one-on-one interaction with the patients, with family members, visitors, things like that, that really drive healthcare.
Sometimes technology makes that easier. Sometimes it makes it not so easy. But I think we have to accept that we're in a state now where we're never going to be able to manage that without technology. So it's learning how to, both from the provider side, learning how to use that well, and also from the system side, learning what really is effective and how to manage that to better support our providers and our patients.
Yeah. So you've touched a little bit on your specialty, which is emergency medicine, and I want to dive into that for just a couple minutes. Sometimes that's seen as sort of a glamorous role, I think, with the way it's portrayed in the media, right? And on TV and movies. Can you talk a little bit about the reality of emergency medicine? What would you say are some of the biggest misperceptions around it?
Everything you think it is. It is just glamour all the time. It's action. It is,
You got
So-
TV cameras in your face all the time. Yeah.
Exactly. So obviously, one, I've never watched ER. So I think ER was probably like one of the things that really brought that kind of perception to light, I think, in the public. And they certainly played on that, but I've never really watched the show, so I can't really comment on that. But what I can say is I think there is a perception that it is incredibly stressful, that every moment is an emergency. And the reality is that there's a lot of diversity to the patients that we see in the emergency department. There are things that are truly life-threatening, where decisions in a second make a difference between life and limb, and those situations exist. There's a lot of more routine care. There's a lot of there's a lot more not chronic care management, but chronic conditions, acute exacerbations of chronic conditions that are managed in the emergency department. And so there's a lot that is not the moment by moment decision making. The thing that's the same across all those is really the role of the emergency providers to gather information, process that information, and in a timely fashion, whether it is something that matters in seconds or minutes, or something that really you're going to decide in over the course of your shift, but to process that information and make decisions, and then move on with that. And I think that's the part of emergency medicine that has stayed the same. There's been a shift in the type of patients that come to emergency departments across the country. It's less and less injury and trauma related. And that has to do with improvements in automobile safety and other safety devices and things like that, and more medical things that come to emergency departments, which is really related to the complexity of patients that exist in our communities.
So we know you've also focused a lot on safety and quality during your time here. So can you share some of the highlights or biggest accomplishments that you have seen in that area?
Yeah. So that's kind of a hard question to answer. And the reason that it's hard is because I think some of the most foundational things that have happened around quality and safety are not maybe the interventions that we've made, but the advancement of the science of safety and understanding of quality and how to drive change in an organization, and some of the structural things that people may not necessarily appreciate or see behind the scenes that have allowed us to continue to improve. So we've certainly seen dramatic improvements over time in healthcare acquired conditions like catheter associated or central line associated bloodstream infections, catheter associated urinary tract infections. Those are things we still work on, and we're still not complacent or satisfied with our performance. And with the pandemic, we've seen we've seen some resurgence of those things. But if you look back to where we were years ago, I think there's a couple notable things. One, I think we've accepted that a drive towards zero harm is possible and is actually an obligation for us. So I think that's a big shift that's taken place over my career and thinking about quality and safety, is that we can drive and focus and someday hopefully achieve zero harm. We've not done it yet, but we've dramatically improved things, safety in the operating room, and a number of things across the organization. So I think those things are important, and the fact that we can drive towards zero harm still have room to go. Yeah, and so one thing I would say is one of the things that, well, the thing I think that got me interested and helped further my drive in administrative issues really has been the idea that, I could be the best emergency physician I could be, and I could do a phenomenal job of caring for those patients that I saw on my shift and have that impact. And I've never gone back to calculate how many patients I've seen in over 30 years, but it's a lot. But it occurred to me, at one point when we were working on system issues and flow issues in the emergency department, that if you're able to influence the system, and if you're able to make the best thing for the patients, the easiest thing for our providers to do, the impact that you could have across patients is going to be much broader than even if you were the best emergency physician or surgeon or pediatrician or psychiatrist or whatever else in the organization. And so that idea of how do you improve the system so that we provide better care to more patients, that's really been the fundamental driver of why I've pursued, trying to solve problems around safety and quality, first in the emergency department and operational issues, and then realizing that many of those issues are issues that either exist or are systemic in the hospital, and trying to work on those and create structures and systems that help solve those issues and create sustainable solutions so that you can have that broader impact over time. And one of the things that we've done that I think has been fairly unique and has turned out to be interestingly valued by people is, one of the things that we were thinking about is how do we recognize performance around safety? And so Marge Calarco was the chief nursing executive at the time, and I was the chief medical officer, and we really came up with this concept of the 365 Days of Safety Award to really try to drive a couple things. One was the focus on safety, but also the focus on performance. It was not just, a month of safety. It was not just achieving something that we started an initiative. It was really to recognize that if you could prevent a safety event that you were working on your unit for greater than a year, 365 days, and that really speaks to hardwiring things. It speaks to the sustainment. It speaks to the breadth of the impact. And it speaks to the fact that this is not just, something that's going to fade away. And so we started that and really started recognizing units that had achieved 365 days of some of the healthcare acquired conditions that we track, CLABSI, CAUTI, falls with injury, pressure ulcers. We started also early on in our hand hygiene journey, recognizing hand hygiene. And I think the units have really appreciated it. We've had some units that have had multiple years of preventing safety events. And so I think it's been a great way to elevate the conversation, a great way to recognize people, and a great way to kind of focus on what is of real value, which is that sustained performance in our safety efforts.
Yeah, and I think that also points to the importance of teamwork, right? I mean, like you said, you could be the best doctor that you can possibly be, but if you don't have the people around you that are also looking out for this and have also made safety a priority, then those things might still happen, right?
Yeah, it's a great point. And we say that at every one of our 365-day safety award events, is that what we're really there for is to recognize the teamwork and the effort that it took to make this happen. Because it doesn't happen because you have one really good nurse or one really good patient care assistant or one really good respiratory therapist or one really good doctor. It is the coordination of that care and communication and mutual respect across the teams that allow people to perform at those high levels and achieve those persistent prevention of safety events. So I think it's a great point, Dan. I think it is really the teamwork that drives that. And we've tried to recognize that when we go up and provide the awards.
Absolutely. All right. So talking about teamwork, obviously the pandemic for the past 2.5 years has been a challenge for everyone in healthcare. What has it been like from your perspective as a chief medical officer, helping the organization sort of navigate its response to COVID-19?
Yeah, again, a very unique opportunity to be in a leadership role during that time. And, the thing that I would reflect on the most is the evolution of it. Because the problems that we were trying to solve, and we did the best we could, and we made the best decisions we had with the best information at the time. You could probably look back and say that maybe some of those weren't exactly right. But the interesting thing about it was, and one of the things to consider is that there was no science. This was a new disease. We had no data around it. And so we were, trying to gather information, trying to understand the science while we were trying to make the best decisions possible to manage the organization. And I think that's true across the country, and true across decisions that were made. It's kind of easy to look back and say, wow, knowing what we know now, maybe we should have done things differently. But I think in the during the moment, we were gathering people together, we were getting the best information that we could, and we were trying to think long-term about the decision that we make to make the best decisions for the institution. I think it was a really challenging time for us as an organization. And I think one of the amazing things that came out of that was the ability of people to pull together, to collaborate, to really pitch in, and there wasn't a person or a part of the organization that if we asked for help or ideas or effort or participation that didn't say yes wholeheartedly and jump in with both feet. And that's true across job families, across administrative structures, across all parts of the organization. I think the hard part of that, though, is it was incredibly exhausting. It was exhausting for leaders. It was more exhausting for our frontline staff. And I think what was particularly exhausting was the uncertainty around the disease, uncertainty what the trajectory was, uncertainty around risk, the risk of infection, both to yourselves, the individuals, to your families, to our patients, and then how best to manage that risk. So I think that was really exhausting. And then, it seemed like every time we were getting a break, then it would come back again and we would have another series of challenges to face. I will say one thing that encouraged me through all that, though, is at every turn, I think we learned from the decisions that we made previously. We captured that institutional knowledge. We tried to be intentional and thoughtful about what have we learned that will make us a better organization and help us make better decisions going forward. And so, while it feels, I think, to many like it's taking us a long time to come out of the pandemic, I think that, whenever COVID is over, if it's ever over, I think we'll look back and we'll be surprised at how many things we did during that period of time or subsequent to that helped strengthen us as an organization and really will help us move forward. I think the other thing that the society has changed around us during the time of the pandemic, and one thing I'll comment on is I think the level of incivility and the seeming lack of inhibition about people sharing their perspectives or their around and being uncivil, I think it's different now than it was prior to the pandemic, and we see that in increased workplace violence concerns in our organization. We're trying to do many things to address that, but I think that's one of the things that's fundamentally changed in our society. I hope that we can change back to a more respectful, civil society, but I think that's also weighs on us as providers and as members of our healthcare system, because we certainly feel that across the health system.
So using everything you've learned during the pandemic or just anything else you've learned throughout your time here, do you have any advice for aspiring leaders at Michigan Medicine?
Yeah, the thing I think I would say is that leadership is a journey, and people that aspire to leadership positions or find themselves in leadership positions, I think need to understand that. I think they need to also know that it is a skill that can be developed. And I would ask them to really be intentional about trying to develop their leadership skills to best serve the groups that they are leading or have been asked to lead. I think, oftentimes what makes you successful in one role or successful at one level of the organization aren't necessarily the skills and the approaches that will make you successful at the next level. So at every juncture of, I think, increased leadership, you need to reflect on what it is that you do that made you successful there, and are those the right things? Is that the right approach to be taking at that next level of leadership? And be very intentional about how you show up as a leader, and how you continue to develop your leadership skills. We've got lots of resources across the university and across the health system for people to tap into. But I think the most important message that I would give people is, I think, the intentionality to that, and that it takes work. It's not, I think sometimes people look at this and say, oh, well, they're a natural born leader. And I think there is some of that people have there are some traits or competencies that allow you to potentially be more natural at that. But I think anybody who has been a really successful leader has had some intentionality to their leadership development and their thoughts around how they want to lead and what they're trying to accomplish.
Yeah, I love that. I think that's great advice. Well, thank you so much, Dr. Desmond, for taking some time to reflect on your career here. Now, before you ride off into the sunset, we do have just a few more questions for you as part of the lightning round when we ask our guests 4 quick fire questions. So you ready to go?
I'm ready.
All right, first question. What is the first thing you plan to do when you retire?
Well, the first thing I plan to do when I retire is I'm traveling to South Africa, because my son has my oldest son has married a woman from South Africa, and we are going there to celebrate their wedding. So that'll be the first thing.
That sounds amazing. All right, what will you miss most about Michigan Medicine?
I think the thing I will miss the most, and again, this is like that leadership intentionality question a little bit, is the people and the caliber of people that work here. It's an incredible opportunity and an honor to be able to work with people that have the level of expertise, motivation, dedication that we see across our staff and our faculty and everyone here at Michigan Medicine. So, I think anything that I have been successful in has been because we've had tremendous teamwork and effort from others. And so that's the part that I'll miss. One of the things I've thought about is, like, what are those things you do to maintain some of those connections, and how do you fulfill that kind of going forward? And so I'm thinking about that as I retire.
So since you are probably very familiar with the city of Ann Arbor, what is your favorite Ann Arbor restaurant?
Favorite restaurant? Spencer.
That didn't take long to think of it, huh? All right, the holidays are coming up. Do you have any fun family traditions?
fun family, well, I mean, I think we do the typical things. One of the things I do is I like to cook. I cook the turkey. So and we have turkey for both Thanksgiving and Christmas, as I think many families do. And so that's one thing I always look forward to doing. That, and then I guess the other thing that might be a little novel is, for some reason, this came from my family. So I grew up in Nebraska, nowhere near the ocean. But we have oyster stuffing with our turkeys at Thanksgiving and Christmas as a side. And it started, I think, with my grandfather, who always liked seafood, and so my grandparents would have regular stuffing, and then we would always have a big bowl of oyster stuffing. And if you've never had it, it's phenomenal. So we make oyster stuffing at both Thanksgiving and Christmas.
Wow. Wow, those were really good answers. All right. Well, thank you so much for joining us, Dr. Desmond, and we want to wish you the best of luck in your retirement.
Thank you very much. I appreciate it.
Thanks again to Dr. Desmond for joining us recently as he prepares for his retirement from Michigan Medicine. In addition to today's podcast episode, be sure you check out Headlines later this week for other featured stories, including a look back at some of the high reliability work that has taken place throughout 2022 and a glimpse of some of the holiday parties taking place at Mott. Find all that and more at mmheadlines.org. All right, it's time for the weekly trivia contest. This week's question is, who will serve as interim chief medical officer for U of M Health once Dr. Desmond retires? Once again, who will serve as interim chief medical officer for U of M Health once Dr. Desmond retires? You can find the answer on Headlines, and once you know it, send it to headlines@med.umich.edu for the chance to win a prize. And that's all the time we have for this week. Thanks again to Dr. Desmond for joining us, and thank you to all of our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.